part of the first conversation. I just want to let her to lead this conversation, and I will get more. And before we start, I just want to really thank her uh, for coming up. I had a death in my family for the previous meeting, and I couldn't be in. But I really appreciate Julia for her for being so helpful for that day. Thank you, Julia.
You're very welcome. It's always my pleasure. Good evening, everybody. We did have a presentation last meeting by Dr. Cunningham, and a lot of questions started coming up after this presentation that was done. We had no knowledge of what the program was or what was coming down the pipeline. So once we heard all the information, a few people had questions, and myself, we questioned a lot of things that were presented, and a lot of questions were left still unanswered. Unfortunately, after we saw that, then I did see Dr. Cunningham on the news re-explaining it. And then I saw the news, and maybe after the presentation, I believe there was a place opened in Harlem, and there's a lot of backlash from what's going on in that place. So I'll share what I saw on the news after the presentation. And that way everybody, I don't know who saw the news, who didn't, but I'll share it then. So if you're ready for the presentation, let's hear, and then we can probably get the questions answered. But there are more questions than there are answers at this point.
Right, I got the presentation and it's up.
Julia, just to let you know, I did see the news piece, and as you know, I asked questions on this, and you had told me that there were going to be a presentation today. That's why I'm on. But definitely, there are major concerns, at least in the East Harlem one. I don't know about the Harlem one because they didn't show anything on the Harlem piece, but I know that in East Harlem there was questions, and even though the council member of that area, which is part council member of this community board, she agreed that this should continue going on. I think that we need to review it a lot better and stronger before we could say yes on it.
Yeah, and I'll bring up some issues after the presentation, but I want to see what the presentation is, fill in the gaps from the last one.
Hi, Julia. My Dr. McRae should be signing in shortly. Just give me 1 second. I'm just going to double check to see if he's on.
Potentially being people that were exploring these theories in the context of the United States military, the United States Pentagon, and then you have these questions of January 6th. Now, it's the job of the
While the doctor comes on, this program, if I understand it, is a program where people can go in to a facility and use their drugs there. So that way they can prevent overdosing. So there's a concern there in itself, but that's what the program is, providing a place where people can use their drugs.
Julia,
Yes.
the only problem that I saw with the piece, not the only problem, one of the major problems that I saw with the piece was that police officers were removed from the area, and guys or individuals were selling narcotics in not more than 100 feet away from the doorway. And that becomes a major concern, and that's one of the reasons why I had told you we need to discuss this a little further.
Well, that's concerning. If you're providing a place where people can use drugs, they need to buy it.
So that's why I'm saying.
Yeah, that gives people an opportunity of making more money and selling drugs right on our street corner. They were selling it right under the awning that was set up for the police officers, and the police officers only covered the grand opening, but they weren't scheduled to keep covering it. So that's going to open up a door for our dealers
Exactly.
to come into our neighborhood and sell. And another concern is that where are these people coming from? Are we inviting more of this type of behavior into our community? That was one of the concerns I had.
Erica, I think, is the doctor on now?
Yes, hello.
Hi, good evening.
Hello, good evening, everyone. Uh, I'm sorry I joined late. My apologies. My name is Michael McCray. I'm the acting executive deputy commissioner for the Division of Mental Hygiene at DOHMH. And so I'm happy to be coming before this body to kind of discuss the overdose prevention centers. I'm newly kind of in this role, and so I definitely want to come have a conversation with you all and to kind of discuss the whys and kind of some of the stuff that we're seeing, even what we know about opioid overdose prevention centers. So with that, I will go to the next slide, please. So I know that folks on here have been hearing about the opioid epidemic for some time now. Many people may ask, why now? Why is it the time to seize? And I think this graphic right here very, very clearly shows that. We have 2020 was the deadliest year of the overdose epidemic here in New York City, as well as around the country. If we have some kind of initial data from 2021, the first quarter, and we're on track to be even higher this year. So there's a very much a concern around the time being really now to act and to take advantage of the ability to kind of put this valuable resource across the country really, and definitely New York City. Next slide, please. So this is a map of the city. And what we see here is that we have our highest rates of overdose deaths in the Bronx, East Harlem, and parts of Staten Island. This is probably, no surprise to folks on this call. These are also some of the areas with the worst health outcomes overall as well. So we see this kind of, repeated kind of pattern in terms of like health-related issues, and overdose is no different in this space. Next slide, please. So this is the kind of front page of the New York Times when the first day that the OPCs opened up, and that was on Tuesday. One thing that we look at this title, we say, they're calling it supervised drug injection sites, and we're really, really pulling back from that categorization of these sites, and we're calling them overdose prevention centers. The reason why is that there's much more that happens in those spaces outside of drug injection. These facilities are equipped with medical personnel, with really trying to connect people to services, mental health services, wraparound services, social services, really trying to kind of see the whole of the person. Just adding that, these, I will get to some of this a little later on, but these, centers, the kind of the overdose prevention piece of it is really in addition to the menu of services that were already being provided at in the centers, in those spaces. But we have, we really are trying to encourage folks to really reframe this from a drug injection site to one that really provides an array of services that includes a supervised, use. Next slide, please. So, what do we know about overdose prevention centers? If you see the picture down here at the bottom, you'll see Vancouver. This is an example of one of the first models in Vancouver. As you see, lots of people kind of have this image in their mind about kind of what these spaces look like. And they may go in there expecting people to be kind of laid out. But what this really is a very sterile, hygienic, professionally run and supervised facility where people can more safely use drugs. There also is lots of education that happens in that space. So where those spaces are constantly giving information, educating folks who are using drugs, trying to connect them services to them to services in that even while they're in that space. Equipment, and there is constant oversight of their of consumption there. But again, in the end, the idea is that this is one addition to the menu of services, and really we're providing individuals or folks with a way to connect to other health services, including drug treatment. These are some of the folks who normally they get missed by the healthcare system. So it's a way to really start connecting them into those services. Next slide, please. Again, science supports the benefits of OPCs. There are over 100, OPCs across the world. We have 30 years of data around how OPCs work and what are some of the benefits of OPCs. So we see a reduction in overdose deaths in that specific neighborhood. We see a reduction in public drug injection or public drug use and syringe litter or like dirty needles, because people have a place to go and use them, discard them, a safe way. We actually see a reduction in drug-related crimes, and not a significant increase in serious crime. And again, they're serving folks who are not in contact with other health services that they critically need. And we see an increase of use of primary health care and drug treatment. So I think one of the kind of first pieces here is to really pull back and think about, what we're actually seeing in the surrounding areas. And we do not see an increase in crime. We see a reduction in these kind of syringe litter. And actually, in one study, it actually suggested that for every dollar we spend on OPCs, we see about $4.22 of savings that can be used to actually reinvest. Next slide, please. Again, here we have another kind of picture of. Could you go back? Sorry, I'm sorry, too quickly. We saw a picture of the actual center. I believe that's East Harlem Center. Yes. As you see, it's great. I'm sorry. Let me just kind of give a little bit. Sorry, just as I want to you folks, you'll see a kind of a mirror that's there. They have individual booths. And kind of the purpose of the mirror is so that people who are supervising can see the person who is using and catch that person before they, fall out or have kind of go far in that kind of overdose experience. But it also gives the folks who are at those booths the opportunity to see behind them, look behind them. So this is kind of like the setup of it. It's very, very well supervised and very well lit. So just, again, wanting to kind of really dispel a myth about how these spaces may look. Next slide, please. As I mentioned earlier, over 60 jurisdictions worldwide with over 100 OPCs, 30 years of evidence. There is, there is support and growing support across the country. Philly, Seattle, San Francisco, Rhode Island, New York State, kind of at large, is also supportive of this. So there is, growing support. And we would actually, we think that this is a service that could benefit many, many communities across the city. Next slide, please. Overall, we know that OPCs will save lives and improve our overall health across the city. We did a feasibility study in 2018, found that for OPCs, if they were put together, they'd be saving 130. They could prevent 130 deaths and save up to $7 million in direct healthcare costs each year. The quotation at the bottom is from a person who used drugs. I'm gonna read it out. Having a place to go where there's others around me, it could be uplifting and not only save my life if I were to overdose, but save my life in other ways. I think this is important because I think this quotation to me really speaks to the humanity of people who use drugs, and also, I think also speaks to how I know and I have seen these facilities run, treating people like human beings and with dignity and respect. And so it's a really important kind of piece that I think is should always be on the forefront of our minds. But across the two facilities that we have right now, just since Tuesday, they've had over 600 uses of the booths. Many of whom are some of the same people. Again, I want to really I really want to kind of also flag for folks that really our way of thinking around this is like working with people who are already in the neighborhoods to provide an added kind of piece to their menu, so that relationship is already there. So I just wanted to kind of again put that out there. And our current data shows that since Tuesday, we've had 15 situations already where there was an intervention that was given to someone who is at high risk for overdose, and we've been able to do it in less intrusive ways because we're able to catch people, before they do kind of go into that state of overdose. So next slide. I thought I wanted to kind of give a brief presentation to open up, a discussion, and kind of talk to this group. And hopefully I can answer all the questions. I'll do my best to do that. So can we drop out of the presentation or?
Sure. Now I'm going to leave it up, Doctor, just in case there are questions.
Okay, that's fine. That's fine.
Especially with the stats, I just want to make sure that people see that again.
Okay.
And thank you for the presentation. I just want to let you know that you're joined by the chairman of the board, the first vice chair of the board who's running this facility now, and the committee chair, Luis Marrero. And we do have quorum for this committee now. So I think Madam First Vice Chair is proceeding. And I see that Chairman Crespo has his hand raised, Madam First Vice Chair.
Thank you, Ralph. I'm sorry. Go ahead, Julia.
No. I was just gonna, but I'll wait until you had your question. It's probably the same one. Go ahead, Bobby.
I have two questions, and probably more after other people ask questions. But right now, how are participants selected for this program?
So individuals who are, in the area, who are using drugs in those areas, connected to that service, we're relying on kind of word of mouth. We do have in the current areas, there are joint operations occurring between Department of Homeless Services, DOHMH, health and hospitals in the area to kind of usher folks to the space. Usher people who appear to be folks who could utilize the space. They also have drop-in centers. These particular providers have drop-in centers, so there are other things there as well to offer.
And I see that, and Ralph, thank you for leaving it right at where you have it at, which is the rates of overdose in the highest in the Bronx and Harlem. And I don't see, I see board 2, but I see more board 1 than I see of board 2. And so, why is it that community board 2 should have this in their within their lines when the mayor came out with a program not more than maybe 8 months ago, and he had stated that he was going to put canisters so like that people can drop their needles in there. And what happened was that the canisters here in board 2 were hardly filled, but the ones in board 1 were overfilled, and it was falling onto the floor and all over the place. So why would board 2 benefit out of something that would benefit more in board 1?
So I think I think of this question as twofold. On the one hand, we went with providers who were kind of ready to go, who had the ability to do that. We also, I think that's the first piece. The other piece is that we believe that this is something that really should be in multiple jurisdictions around the city. Even though board 2 may be less than board 1, there's still a significant problem, concerns around overdose and CB2 as well. So I think it's kind of a both and. It's not like either you or me. I think it's like we would like to see this. We're supportive of this kind of as a broader strategy. And it just happens to be that we kind of opened up in these 2 spaces. But we are, there is interest in other areas to, providers or who want to know more, asking questions about how they can get this valuable service in their areas as well.
Well, just to follow up on my question there, I just wanted to know because board 1 has an extremely amount, and I used to be the former district manager of there. So I know what is going on in board 1, but there's also board 5, board 6, which is, you have a lot of drug use in those particular areas. And the council member that supports this the most is Diane Ayala. And so, and she covers all of board 1. So, I don't understand why board 2 would be on there. And you got, you put down Hunts Point, Mont Haven, 75.3%. But the truth of the matter is that most of that is in board 1.
I think my answer is still consistent. Is that this is a strategy we want to see in many ends across several different jurisdictions of the city, and so I don't think it's restricted to, I don't think it's restricted to one space or another. I think it's really something that we would like to see more broadly. I think that the fact that board 1 is higher than board 2 doesn't negate the fact that there are concerns in board 2.
And I'm not saying there ain't no concerns, but we have already several. We have Acacia, okay. We have we have other drug programs in this board, and I'm now trying to see, why is it that board 2 continues to be on everybody's lips when in board 2 you don't see that kind of usage as you see in board 1.
Okay, so maybe I've come across in the wrong way. Like I'm not sure if you're thinking that I'm saying that there's going to be an OPC in board 2. Right now, there are no plans for the Bronx. I'm really here to educate you guys, and kind of help you and kind of let you know kind of what these centers are and the services that they provide.
Well, your predecessor came out not more than 3 weeks ago, and came out and says, we don't care, we're going to go into board 2 regardless to what.
I'm sorry, I missed part of that.
Dr. Cunningham, 3 weeks ago, came out and stated that we're going into board 2 regardless of what position we take. And I'm like, what do you mean?
I mean, there are again, I could say there are really no plans for the Bronx at this time.
Go ahead, Julia. You got
Oh,
it. I'm sorry.
I
no,
can't really speak for
thanks, Bobby.
Dr.
Thank
Cunningham,
you.
but we'll let you know as soon as kind of any expansion happens, like, you know, and where they'll be. Like, I can't speak for what Dr. Cunningham said, but I can say that, you know, firmly that there are no plans for the Bronx at this time. And if there are developments, I'm happy to come back to this body and tell you.
Okay,
Thank you,
Julia,
Doctor.
you go ahead.
Okay, sorry, Bobby. Thank you, Doctor. I like the way you did give us numbers for Hunts Point / Mott Haven, 2 different places. But I didn't hear how many people so far have been taken care of. So you gave us numbers for this, but you didn't give us percentage. How many people were seen? Was it successful? Those numbers you did not give us. So right there and then I start questioning, why are we getting some numbers and other numbers we're not getting? The other part of this is I'm a licensed social worker. I've been social worker for over 40 years. And you have a person that you're letting them do this here, um, something that society has questions about, and we're trying to get rid of the stigma, and I understand that, but you're leaving them in the same environment. So how is their behavior going to be curtailed um, when you're leaving them in the same environment? They're coming out of there, they can buy drugs in the corner. So are you really helping them, or is this something to pacify them, let them use their drugs, and come back and let them use their drugs again? Because them going back into their same environment, it, to me, and what I've seen, is not conducive or effective. So I don't know if you have any studies regarding is this effective, and how many people have you treated and how many people actually have benefit from it? Or is it just a revolving door, them continue to use drugs over and over and over?
I think the literature is fairly clear that these are effective, that OPCs are effective in getting people connected to services, you know, and, you know, decreases in overdoses. So, I mean, to me, that is effectiveness right there, right? I think,
I appreciate your words of decrease and everything, but I noticed you use numbers here, but you're using decrease, and that really doesn't tell me anything.
well, these numbers right here represent rates of overdose in the different areas. So
Correct,
yeah.
correct. And those numbers I see. But
And we
when
could,
you use others, you're seeing decrease. We don't know what that means.
yeah, I mean, we're leaning into decades of evidence from other countries and having already saved lives. I mean, we can share the studies, right? I'm happy to share the studies. I mean, I think, you know, and we can share all of the data, the underlying links to the links to all the underlying data. Uh, maybe I'm not really kind of getting your question. I'm sorry. I mean, I think maybe I'm missing something.
Can you just address, you're leaving the person exactly where they use the drugs, exactly where they buy the drugs, exactly where the behavior occurs over and over and over again? How does this help them?
I think we have to go back to kind of the tenets of harm reduction. So the tenets of harm reduction say, I mean, kind of posit or preclude, or they presume that individuals are going to use drugs either way, right? Anywhere they
Okay.
are. You know, having an OPC in a place where they can be supervised is going to prevent them from using too much. You know, doing it in the wrong space. Criminal justice involvement. There are lots of different layers to kind of why the kind of harm reduction kind of approach works. And through that process, we're already seeing many people come back over and over and over again, right? Building relationships with individuals who are there, and that's how you create a trusted source within that organization to connect them to services. Maybe it's not the first time that they say, yes, I'm ready for drug treatment right now. Maybe it's the 10th time. Maybe it's the 15th time. Maybe it's the 3rd time. After some time, the person comes in there, they get the relationship, then they trust the person. Oh, this is Bob. I see Bob all the time. You know, what you got to say today, Bob? And then Bob has that relationship helps to bridge that person to care. So I think it's I kind of I mean I think I reject the kind of idea that like you're just kind of providing a space for people to use and you're not helping them out. I think that's part of a process. I mean, as folks know, I mean, we probably all know of individuals who have people in their family who are affected by drugs. You know, I mean, maybe it's not really about me, but a part of my own, kind of story is my father was a heroin user in the 70s and died from AIDS in the 90s. And so this kind of a space where he could have been using kind of safely made it give him a better chance of living. And so I think that it's, I don't think this is the kind of space, and the research does not bear out that people actually don't get helped by this and get connected to care.
Yeah, I'm just concerned about the community because we are part of that community, and I'm concerned about bringing people in, and it seems like it'll be a revolving door. Use your drugs, leave. Use your drugs, leave. And the people are going to be there selling it because I know the people. They're going to be there. They're already sharpening their thoughts. How much can we sell? And people are up. They're going to take the opportunity to do such things. So I am concerned about the people there that want to live
Yeah.
and don't want to be exposed to so many things. Same way we can, try to protect the people who want to use and give them a safe space. We also have to think about the people that don't really want to or should not or really don't want to be exposed to certain things. So we have a population and we have to think of everybody.
I absolutely agree. I think we have to think about everyone. We know that people really don't travel. I mean, there's no one from they're not going to travel to use an OPC, 2-3 miles away. So these are people who are already there. So I think the idea that people kind of come from afar to use this service, I think is maybe misguided, because that's not what's happening kind of on the ground. I also want to just again reiterate this idea that it's overdose prevention center and not a supervised injection site, because there are other services that go on there in that space.
And they bring their own drugs, right, doctor? They bring their own drugs to this?
Yes, people use their own drugs. They come in, and before they're able to use a booth, they have to identify or define what one dose is for them. And they're allowed to use only that dose, and they're supervised in that process, and then afterwards as well.
And then just the last one, and your experience is person will use it once and their return trip is tomorrow and they're not going to use in between?
It varies. Some people come, twice in the same day. Some people come, every few days. I mean, it really just depends on the person. Everyone has different patterns of drug use. But I think in the end, they would be using those drugs there or in the subway. And in the subway, there may not be anybody who can save them.
Okay. I'm reminding everybody to put your name and everything in the chat. That way we can keep in contact with you. And if you have any questions. Okay, Doctor, I'm done. Thank you. Anybody else?
Yes, I have my hand raised and then Shatoria, but I just want to thank the doctor for coming on, and that there are no plans in the Bronx for this OPC yet. I know I had conversations with Anita already about this. Just those numbers, Hunts Point and Mount Haven, I know Chairman Crespo was alluding to it, the fact that we're two separate communities, and we already know from data that was driven by the city, in particular with the syringes, the syringe disposables at the parks, right? We only had a few dozen in our parks, where there was thousands and thousands in the South Bronx. But my real concern here, doctor, and I want you to take this back and keep this in mind. What you're describing now is in an ideal, an ideal setting, and all of this comes down to the provider. And we in this community, why we are very concerned, and these questions are coming out, is, and you mentioned a harm reduction model. We have a harm reduction program in our community that's not a neighbor to the community board. And the community board has to go into damage control in defending this harm reduction program, because they have their clients loitering outside. They have their clients in their building, getting high, smoking in the building, leaving garbage in the building, the same building where the harm reduction resides at. So in our experience, right? It comes down to the provider. And when we have a drop-in center that deals with the homeless, as Bobby mentioned, we have a lot of also providers that are funded by Oasis. We feel like we do our fair share. And the problem is that the provider itself is not in this ideal setting as you're describing it. And then the burden falls onto the community. And that's where this problem is now. And that's where this board is really, really concerned, because from experience, right? They come in selling a beautiful idea. What you're describing is a beautiful idea. Only if the provider is living up to the the city got to hold the provider accountable for this. That's the only way they're going to be good neighbors. We have already experienced a harm reduction program that has no ties to the community board, no ties to the community that they actually are in, because there's programs around them that are complaining about them. Yet they continue to go on as business, and the community is suffering. And that's what I need you to take back, Doctor, here. And this is why Board 2 is really concerned. And I'm really happy you're saying there's no plans for it in the Bronx. But when that plan does come, where do you think it's going to come at? It's going to come right back in our community. And that's what Chairman Crespo was alluding to. So these are just my thoughts as the district manager. Thank you.
Okay. No, I appreciate it. I can say it again. Like at this time, like there are no firm plans or timeline, right? But we're looking forward to expanding, beyond the 2 sites. I mean, I will be honest with that. And I think and we can also very much appreciate, providers, and their relation and the need for them to have relationship with community. And so, that's something that, that is important to us. So, I'm thank you for your feedback. I mean, I'm taking all this back, these sentiments. I hear you. And so I want you to know that. And so like I said, there are no firm plans. If there are, as we hear about things, and like we expand, like we definitely will come back, to kind of, inform this body.
Thank you, Doctor. Shatoria has a hand up.
Anybody else have?
Shatoria. And
So
Lynette Omo
Shatoria?
has questions in the chat.
Okay.
Okay, so my first question is there a direct correlation, because you're showing the rates, right? So is there a direct correlation between the overdose rates in marginalized communities of the South Bronx and Harlem and the EMS and police response times? Because all the way at the bottom, you see New York City, right? So it doesn't mean that that the substance abuse is not prevalent in those communities, but maybe the response times to those communities are greater, or at a less rate than what it is inside of the South Bronx. So then that way that these rates are elevated in the South Bronx and in East Harlem.
Yeah, I mean, I think it's a complicated question, right? I mean, here on this, I mean, I can't speak to response times of NYPD. I can take it back to my sister agency, but I mean, here we do see that all of these kind of these locations on this chart are above the average in this from the total average across the city. Like I said earlier, what we do tend to find is that this, the same areas with the highest overdose rates tend to have the poorest health outcomes, highest rates of incarceration, more calls to 911. These things, I mean, there are structural issues that precede, that go on, 50, 60, 70, 200, few hundred years, right? Like these are things, inequities that exist. And this is consistent with what you see across many different health outcomes, both physical and mental health and substance use outcomes, and social outcomes as well. I mean, that's the reality of it. That's one thing that we're trying to work to really reverse.
Okay.
I
And
have a quick question. Shatoria, I'll wait till you finish. Go ahead.
oh no, I'll wait.
Yeah. So you're looking to piggyback on one of the establishments we have already in the community, just to sort of like have all the services, or this is something that 100% you will be thinking of building from the ground up?
Well, we value kind of that. We value being able to work with providers who are already working with individuals. So we're not like looking to take a, our preference or nothing that we can even kind of discuss is not to take a new organization, put them into the neighborhood. It's like, what services are being there already? What services are there already? Let's use that to kind of add to the menu of services.
I think it's more of the concern of, well, if there's a provider and they're providing preventive services, right, or counseling services, and then you say that you're going to utilize those providers, is it going to still be inside of the same facility where someone is actively in recovery, and then you're going to implement maybe a floor or maybe a room where it's going to be a overdose prevention center? Because it's kind of like, well, does someone, go into a group and they're in recovery, and then the next door is someone who's allowed to come in with substances and be able to utilize them?
So again,
or is it going to be a separate, or is it going to be when she's saying from the ground up, where are you going to build a facility that's just particularly for that, but it's still ran by a provider that is already in the community?
Okay, so I feel like I want to kind of back up. I want to back up for just a second, because I feel like I don't want to. I feel like now we're talking like hypotheticals, like who we're going to use, and they're really, like I said, there's no discussion around any particular provider or timeline or anything in the Bronx. There's not that. So I don't want to. I mean, it's like you can get into like kind of like a mental Jedi of trying to figure out like, well, how's it going to be? What they're going to do? I think that's all like stuff to come and conversations that we have, but there are no plans. I mean, I can speak to kind of what we're doing in Manhattan and how that's working. And I mean, to me, that is kind of that's our data that we're kind of looking at and thinking about, and continuing to look at. So but again, I don't want to get into the kind of space of like saying, well, it's going to be this or that, or this is going to look. I think these are all considerations that need to come into play. But there are these discussions are not even that far down the line.
Right. So it's not a hypothetical, because obviously two has already been erected, right? It's just, what is the blueprint for it? How is it happening? So did you already pick someone who was already a provider?
Yes. So
inside that same building, is there other services that were already in place?
So yeah, so the people who we're working with right now had current services that were in place, and they're adding this again to their menu of services. Um, these are extra services that are in those same spaces that already existed there. So sometimes either some of the same people that they see in their other services, and new people perhaps who feel comfortable coming to that space now, and that's the way we can. That's a potential life saved.
Understandable, although it seems a bit counterintuitive to place two services inside the same facility. It kind of seems like it should be separated. The placement of the facilities being that when we see the news, there's a facility that was erected right across the street from a preschool, or Julia, you've seen it, right?
Yes, I did. That was the news I was talking about, that they were selling drugs right in front of it. So that's really, really horrible for that neighborhood. We don't want that to happen in our neighborhood. But as soon as the cops left, the drug dealers went in and they seized that as a moment for them to, yes, and it was across the street from a school. So there's a lot of parents that are concerned.
Yeah. I mean, again, I mean, these are not new individuals. These are people who are going to those services anyway. And so I don't want to kind of I know I want to kind of make sure that we're not kind of going into a place where it's like all these new people are coming into this space where actually that is, we actually see, we're not seeing like more crime or drug sales in the area. Like, where that's not kind of what the data says, happens in those spaces. And those are people who are coming to that space anyway. And that, it's not that, this is not a new flow.
So it feels a little conflicting because when you say that these are people who are already coming into these spaces, and usually the people that are coming into these spaces are coming in for treatment, right? So now, but they're coming in for a different service, which is to be able to utilize. So how does it go from jumping from treatment and providing, the toxicologies or going to groups and things of that nature if it's the same population?
I think.
Shatoria, we're losing you.
Yeah, we lost you there, Shatoria. But I also, Madam Chair, we have 2 other items on the agenda. So, and
I-
Louis
We
hand
understand.
raised.
Can I just say one thing, just to kind of lastly, I maybe like a little bit two-part answer here. They're the same folks because in these specific situations, these were syringe service programs, so these are already people who were using drugs and were getting kind of clean product. And I think I'm wondering whether or not you're conflating methadone clinics to OPCs.
No, we know it's too different. We're in a community where we've had a lot of services in that community. So we're really aware. I think there was also something in the chat. Ralph, can you see what's in the chat? Were there questions from Lynette?
Yeah, Lynette has some questions, or she brought up some points. Is the program going to provide other services such as mental health counseling and a goal to help them stop their addiction? What is the time frame individuals are able to be enrolled in the program? Also, what would be the difference between the kind of OPC program and a methadone clinic? I think a lot of them were answered, but that's that.
They were answered, yes. They were answered. The doctor gave a very thorough answer on all of them, but there are certain concerns, and I think we're still having the concerns. And doctor, thank you for the presentation.
Louis had his hand raised. That was the
Who
last.
that, Louis?
Yeah, Louis.
I'm sorry.
I'm going to turn over the meeting back to you anyway. Thank you, Louis.
Thank you, Julia.
Madam Chair, thank you.
I just have 2 questions. This kind of program, what is the successful rate? And and I'm going to define successful rate. Is like somebody is using or utilizing this service for whatever reason, and these people, for somehow, because of these services, are helping him or her to come out of the drugs. Do we have any story of people who are using these services that are leaving the drugs?
I'm happy that I'm happy to share kind of the studies that are out there with you. I don't have all the data in my mind, but to me, when you can say that you save 15 lives, that's effective.
Yeah, no, but when you say saving 15 lives of people to get overdose or saving 15 lives of people who are coming out of the drugs completely and then getting back to the society as a new person, because then we're only dealing with the issue. We're not really helping them to come out of that.
Yeah, I think it's a both and. Where the data says that people are more likely to get connected to services, and the data also says that people are more likely not to die from an overdose. I think not dying feels like a higher order goal than making sure the person gets off of drugs at that moment in time. The idea is that over time they build a relationship and they get connected to services, and that's what the data shows us. But I'm happy to share those with you. But I think ultimately, in the end, our goal is to stop people from dying, morbidity and mortality.
And then currently, you were saying that you have some programs right now that during this month they help like some people not to get overdose. Oh, they got overdose and they were saved. You say that, right?
Yes.
So I have a question. If these are supervised programs How come it gets to that point that they get overdosed?
They stop them. They don't. They're preventing. They're overdose prevention centers. So once you overdose, you overdose. These are people who are technically not overdosing, we're reversing the overdose because we're able to catch on and intervene very early on.
So that means that they already have gotten the drugs elsewhere before they got there.
Yeah, the drugs, they had. I mean, you can overdose, on one hit. You can also overdose, over a period of 3 or 4 hours. And so having them put them in a space, where they can be monitored is helping them from overdosing. So it's a prevention center.
And just lastly, just to finish with this, it would be nice, and following what the chair Bobby was talking about before, that we have the numbers from Hunts Point and the other community together, from Community Board 1 and Community Board 2. I understand that maybe the Department of Health have them both together, but I believe it would be good to know what is actually the number in Hunts Point, because I really would like to know what's the number in Hunts Point and what is the number in the other community. I really would like to know that.
Yeah. Zip code.
By zip code.
So I don't have the data on. I do not have that data. I don't know if there's anyone on my health department colleagues who may have some information or speak about it. I don't know if folks want to speak to that.
Right. Okay. Yeah, but I understand that right now you don't have it, but eventually I don't know if somehow we can get those numbers. Okay. I would really appreciate that.
All right. So yeah. Okay.
All right.
It's Erica Peralta. Louis, I'm sorry, you're requesting what data? My link got cut off, so I didn't hear what data you were requesting. There are some links that I've already shared on the actual chat for everyone to review. I can send it to you, Ralph, via email if that's helpful. But I just didn't hear what data you were requesting.
What happened is that in the presentation that the doctor gave us, you have Hunts Point and what is the other community?
Mott Haven.
Together. I would like to see the numbers of Hunts Point, only Hunts Point, not Mott Haven. Because right now and it's our belief, and we strongly believe it, and until we don't see the difference, we're going to keep believing it, is that the numbers in Community Board 1 are very high comparing with Community Board 2.
Great, thank you for your question, Louis. So from my understanding of the question is you are requesting data specifically for Hunts Point. At this time, the data that we do have available on our website is per zip code. I can share that link shortly. We do not have it broken down. We've had this request in the past of we don't have it broken down per district or per specific community board. We do know that some boards, like you're correct, Community Board 1 and Community Board 2 do share some locations. So we are aware of this, but at this time we have them split up by zip codes. I will share the link on the chat as well. And Ralph, I will send you a separate email with all the links in one place in the event that anybody else has requested this information.
Thank you very much. Appreciate it.
All right, Erica, sounds good. Thank you.
All right. Thank you.
We have our items on the agenda.
Thank you all for having me come and share the space with you. I appreciate you all.
Thank you, Doctor. Thank you.
All right. So just following up our agenda, we have, I think it's Dave. He's a representative from the Bronx, Westchester Area Health Education Center, and he's going to talk about opportunities for youth interested in healthcare professions, as well as to learn the specific healthcare needs of the community. Let's welcome Dave.
Come in, girl.
Are they here?
Nope, they're not here.
Okay, so let's moving along. Now that we have Josue Melendez, he's from the New York City Department of Aging, and he will gonna talk about the services that are provided for seniors in the community. Josue, are you there?
Hey, Louis, yeah, I'm here. It's going to be Jeanette Reed who's going to be presenting. She's actually from our senior employment unit, and she's going to be presenting on some of the services that they offer.
What is the name again? Jeanette?
It's Jeanette Reed.
Reed, okay. Thank you.
Thank you, Josue.
Hi, good evening, everybody. Thank you so much for this opportunity, and thank you to my colleague Josue for arranging this. Yes, I am Jeanette Reed. I am proudly a part of the New York City Department for the Aging Senior Employment Services Unit, and I am here to talk about this great program that we have, that we are recruiting older Bronx residents for our senior employment program. And I want to tell you a little bit about that. And I'm looking for your help in spreading the news, because this is open to folks who are unemployed, over 55 years of age, of a certain low income, who live in the Bronx and are willing to work. Now, I'm just going to tell you a little bit about it. I don't want to take too much of your time. I know you're very busy and you have a full agenda. This is a short-term paid workforce program. It offers job placement services and assistance with skills training to help people transition back to the workforce. Candidates must be of a limited income, as I said before. We have a team of experts who sit down with each participant after they apply, and they sit down one-on-one to determine their income eligibility. So I can't answer any specific questions about income right now. The highlight of the program is that they get paid while they look for work. Participants receive a stipend of $15 an hour for 15 to 20 hours per week. They receive basic computer and customer service training. They receive occupational training with nonprofits and government agencies. They're put on site, and they may perform administrative duties, or they could do kitchen duties, whatever their interest or skills are. They work with job developers for job placement assistance, we do their resumes and so forth. So the real thing that I'm happy about, I think it's really important that I'm talking to this particular committee on Health and Human Services, is that, and I think we all know this, that work is an important factor in maintaining a healthy perspective on life. Unless we're all, wealthy and can, retire and just not have to work. But many people who are unemployed may rely on it not just for financial purposes, but for a sense of identity, pride, and personal achievement. This might be more important for older people. It can improve your physical and mental strength. It can increase happiness due to a sense of belonging, and increase self-esteem due to a daily purpose and a contribution they make to society. Much, much more difficult to find a job when you're an older person. Finding a job is more difficult after the age of 45, believe it or not. So when you reach 55, which is the age eligible for this program, our folks that come in here, they have a really tough hill to climb. So we provide a lot of stability in order to get over that hump and find a job. It's a real step-by-step hand-holding process. So something that I really believe in. It's something that I'm here in order to ask your assistance. I make presentations to groups. I reach out to NYCHA groups. And if you have, anybody, whether it's your church group or it's parents or seniors that are interested in going back to work, please give them my name and number. I'm happy to talk to them. It's really what I need from you. What I want to do is put people back to work, and I know that you would want to do the same. And I think we can do that. There's a lot of people who need it. That's it. Does anybody have any questions?
Louis, you're on mute, Louis.
Sorry,
Hello?
sorry. So, Jeanette, when you say limited income. Oh, I guess you have a table. What do you mean with limited income?
Right. Well, so that's a little tricky. It usually means 125% of the federal poverty level, and I think it's about $14,900 for one individual per year. But a lot of people do receive various benefits. Maybe they have a pension. Some of those things are allowable. Some of those things are not considered as part of that income. So that's not my expertise. Well, when an individual comes in for an assessment, determine their eligibility, they're asked to bring in proof of income as part of that. So that's something that our intake team does.
Okay. So just have a question. So what it will be safe to tell a senior person, 60 years old, how much money what range, because then it's a range depending how much money they're making. So what range it will be in terms of how much money they can make? And if this is on a weekly basis, this is every 2 weeks.
If I may interrupt, it's usually people that are on public assistance, people that are on SSI, that they usually fall below a certain level. So anybody who lives off of that type of government, Social Security, I'm not sure about, but
Right.
like SSI and public assistance, I think those are the people that you will be safe with telling them,
Right.
they're at the poverty level.
Right, and you're a social worker, so you understand all the nuances and the ins and outs of these things. You would, right? So, yeah, we're considered a low income population, so maybe that makes it. That's another broad phrase, but it maybe lends itself, it's more descriptive. But you cannot be you cannot be employed at all, not part time. Not even if for a day, cannot be employed.
Okay, so I have another question. So we're talking about people 65 years old.
Yeah, 55.
55. Okay, 55. This kind of occupational training, all these are in-person training, or is there some training?
No, we've gone back to in-person.
Okay.
Occupational training. It's been slow, but we've started to open it up. It could be in the kitchen. It could be maintenance, but it depends. Participants who apply to the agency, the program, have all different types of backgrounds and different types of skills. That maybe they were a bookkeeper once, or maybe they did clean floors, or maybe they were a chef or a cook.
And do you have a list of places that you place them, or
yeah, sure,
how that works?
Sure. I mean, it's an assessment of that individual and what are their skills and what kind of experience do they have, and then basically either calling a company we don't have a relationship with or calling a company we do have a relationship with. It's just going out and finding. It's advocating, really.
Okay. I don't know if
I wanted to ask a question, Sonia. I'm on the phone. When you say, okay, because I'm 61, the two barriers that come up. Number one, when there's someone who wants to go back to work and you are on, say, Social Security, the two matters that happen is that, number one, Social Security will deduct money if you're making money. Number two, if you live in Section 8 housing, then they want their percentage. So that's why sometimes it's very leery that people over 60 that's on a fixed income, that say they refuse to go back to work, but they're a little frightened because they'll look at the margin of the money that they're making, and it looks like they're not,
Right.
and then
exactly, and it's like it's like a pendulum, or it's a go wait. that, and it's very individual. Each person has to go in and make their own decision, and that's why I was saying it's that we have an intake team, and each individual that comes in, sometimes when they're in the middle of the program and all of a sudden the minimum wage goes up, they have to get out because that's going to affect the benefits that they get, and it's not going to be worth it anymore.
Right. So that's the question I wanted to ask. Was it like substantial work that you do, like that is like a job that you can proceed to have over several months, or even a new career, instead of just having a 3-month job that increase in your wages, cut off from your Social Security, go up on your rent, see about your food stamps again, get slightly cut off from Medicaid. So how, like you say, how is the job setting? Is it permanent job?
Well, let me make a really important distinction. This is a workforce program. It's not a job. This is This is preparing you, the 61-year-old unemployed woman, to go to a job. Okay. You're sitting in our classroom and we're fixing the resume and we're preparing you the interviews, and we're getting you an interview with so and so, and you do a great job and they hire you. Okay. It's a temporary program. You're only here until you get that job.
Does this program provide stipends? Because at the same time, when you're not a person going out every day, shoes, the car fare. Okay.
Right. But say you're in the program longer, you're only in the program as long as till you get a job. But it takes people only, everybody's different. It takes people longer. Some people it takes longer than others. But while you're in it, it's a minimum wage. So if the minimum wage goes up and you're still in it, you're going to get a letter from the Social Security Administration saying, well, your income went up, so it's going to affect this. And then you're going to have to say, well, now I got to make a choice, and the choice is I can't be in this group. So you're right. I mean, that's the reality of it.
Okay. All right.
Struggle.
Glad to some of your information and share it with people in the community. Thank you so much.
You're welcome. They're all really good, very good question, because that's a problem. That unfortunately people have to make that choice, and
Thank you very much, Gina. But if someone is interested in look for that job, for that part-time job or that opportunity, what should that person do?
So, Luis, I just put my name and my email address in the chat. The phone number, if anybody wants to.
Yes, please.
Okay, I put it in the chat. Excuse me. And my main line phone number is 212-602-6958. And Ralph, thank you, Ralph. I'm going to send him a copy of our brochure.
Please.
And it's been a pleasure talking with you, and the questions are great because it sounds like everybody kind of knows what this is all about. And I would really like it if you could all think of ways in groups of real people who are needing jobs that I could speak to. That's really how we're going to get our classes filled, because for some reason we're getting I'm having trouble getting to the real, to the people who we need to apply, so I could really use that. I'm sure you would love to be part of that as well. I need really want a groundswell of folks to get the engine rolling and get some people back on a payroll and have them feeling a little bit better, about themselves. So.
Yeah, well, remember that probably the people right now are a little hesitant because of COVID.
Yes,
And
yes.
you know, and you're talking about the age group that is really vulnerable.
I know.
for-
Yeah, I know. I got, you know what it is? Sometimes I get too, I don't know if it's idealist or if I just get too hopeful, or I know what you're saying. I should, especially when every time we get hopeful, another strain or another piece of news comes out. So, but I hear you. You're absolutely correct.
Well, maybe that's what it is. So hopefully people get vaccinated, and little by little, we try to get back to our normal.
But
Folks.
that's a whole other discussion, isn't it?
Right.
But
So
anyhow, real
thank
pleasure.
you. Is anyone has another question for Jeanette? So we close this part.
No, I just wanted her to repeat that 212 number, please.
Yes, 212-602-6958.
6958. Thank you so much.
And also, once we got the information, it will be part of the minutes. So you can go get the information there as well. All right, thank you very much, Jeanette. Have a great night, and thank you for being here with
Happy
us.
holidays.
Bye bye. Happy. You know, I have my hat today, so
I know. You're really rocking that. I like it.
thank you. All right, moving along for all businesses. I just want to add, this past December 1st, we have our World AIDS Day. I think it was a really nice night. We had Father Vini from his Catholic church in Hunts Point. He did that part of the services, the prayer, and was a nice night. It wasn't that cold. It was good, and so thank you for those who came out and join us during that day. If there's any other old business that somebody wants to bring up, Julia?
No, I have nothing. No, I'm good.
I thought you did this.
No, no.
All right, new business. Is there any new business coming up?
Just one thing. I'm getting ready to do the seniors in the new building. It's their first time in the new building, so I'm trying to make things special for them. And because there's no money, I have no money. Sokola is gonna have her mother cater for the people that came from the shelter. She's giving me food for 25 people, arroz con gandule and all that stuff. So I'm really excited about it. And Cynthia offered to help me with decorating the place and the serving of the food. So hats off to them, and I thank them. I really thank them.
How many families are you bringing up?
No, they're families, they're individuals. I have 26 from the shelter, but she's giving me food for 25. So we're gonna feed them lunch on the 23rd. So for the rest of the building, what I'm gonna do is I have a potluck. So I'm having them cook their own food. So everybody will get a Christmas party. There's no money, so I have to do the best I can. So I thank everybody that's just coming forward and helping. So thank you.
Julia, this is Bobby again.
No, Bob, come on. No, sorry, Bobby, go ahead.
I'm sorry. I have some concerns on what you just stated, because I know that the councilman has put money in the city budget for you guys. Besides the building, the construction, there was also money put in for services. What happened to that money?
My understanding is because I have a pantry that I keep trying to fill up, and he visited me one day and he actually allocated $10,000 for the pantry. But in order for me to get the money, it has to go to Arch Care. Because the building it's an Arch Care building, but it's still not recognized. They couldn't like spearheaded it to me. They had to put it through another program, the same place that the Yankees gave money to, the day program.
Right.
And the fear was that I was not going to get it. So I just left that alone. But you're right, the councilman did offer $10,000.
So let me go back to the Yankee money then. Did you receive the Yankee money, since I know it was allocated already?
Not for the building, no.
Not for the building. Okay.
Yeah, not for 909 back.
All right. Thank you. Thank you.
Can we like talk about it offline?
Yeah.
Okay. But anyway, Sokola, thank you. Cynthia, thank you for always, and V. They're stepping up and helping me. So
I just got Barbie from the point to volunteer too. Help.
Oh my goodness, abuse her. Okay. I'll talk to you offline about it, because the idea is big and it's getting bigger. So thank you.
Thank you.
Thank you, Julia. Any other new business? Right. Announcements.
We have announcements.
All right.
This Saturday is the coat drive, the annual coat drive with the bid and the council member. It's at the council member's office. It's starting at 11 o'clock. It's we're on the flyer, and the precinct council is Ponce Bank as partners. It's first come, first serve. The coach is for the youth. I guess they reach up to a certain size. I think the size go up to like 14 or 16 or something like that. So it's for young kids, both male and female. I know the weather's not supposed to cooperate, but we hope to have a good turnout for that. And I also want to acknowledge, Mr. Chair, that out of 8 members, you got 7 present today. So that's a good healthy attendance for you. That's my announcements.
Also, I just want to announce that on December 16, from 11 to 4, at the Monsignor de Valle, no, at the oh my God, 167 at the I forgot the name of that basketball court. Philip Dreams Park.
Philip Dreams.
Philip Dreams Park, 167 and Westchester. Urban Health Plan is going to be given 400 bags of non-perishable food. I don't have the flyer yet, but as soon as I have the flyer, I will give it away. And I will send it to you guys. So anyone in the community who is looking for non-perishable food, they can come and they will get it for free. Is anyone?
Yeah, there's another one that just came in. I'm sorry, Ralph. The Salamanca's having an event tomorrow, the 7th. The Oath. Give me 1 second. I'm so sorry, but I will send it to everyone who was present today. I just remembered about it right now.
At what time is gonna be?
I'm gonna get the information right now. Just bear with me.
Cindy, I'm sorry. You sent me that. I'm getting it up right now. That was just on a different attachment. I'm sorry. It's coming up right now. So tomorrow, the Oath, the Office of Administration, Trials and Hearings, their staff will be at the council member's office between 10 and 4. So if anybody has any issues regarding summonses or so forth like that, that would be the perfect time to come to his office. I'm sorry for the background noise. But there's the flyers up right now, and everybody's interested, they can reach out to the council member's office.
I'll send the web chat with these flyers, and once Louis sends me the once they create his flyer for his event, we'll send that out as well. So just make sure you leave your information in the chat if you haven't done so.
And my last announcement is that as you may know, Urban Health Plan is still vaccinating against COVID-19. They're doing vaccination from Monday through Saturday from 9 to 5 in the main site, which is 1065 Southern Boulevard or 1054 Simpson. Also in Bella Vista, which is in Hunts Point, Monday, Tuesdays, and Fridays. It's also vaccinating. I can tell you that maybe because of the new variants, people are really coming out and getting their booster. So we're doing booster, we're doing, Urban Health is doing the booster, first, second dose, third dose. So we're really encouraging and telling everybody to come out and get vaccinated.
Louis,
Louis?
if they didn't, I'm sorry, Julia. Go ahead.
They need appointments? I'm sorry.
No,
Do
no
they need-
appointments. You just walk in.
All right,
Okay.
Louis, and what if you didn't receive your first 2 shots with Urban? Can they still go get the boost over there?
Yes, as long as you have your card,
Okay.
that's all you need, your card.
Okay.
So you could do only the booster there. Doesn't matter.
All right. Just send me those flyers. Okay.
Yes, I will. Any other announcements? Wow, everybody's so quiet. Okay. So if no one else has any other announcement, I'm gonna call the day off. So any emotion to end the meeting?
I make a motion.
Okay, Julia Cruz
I
making a motion.
second it, Sonia Ferguson.
Thank you, Sonia, for a second. So thank you very much, guys. Have a great night, and I will see you soon in another meeting.
Yes.
Okay.
Good night.
All right. Good night.
Take care.